Welcome to the Uniformed Services University Leadership Education and Development Program, or as we refer to it, the LEAD program. USU serves to educate members of the Army, Navy, Air Force Medical Service, and U.S. Public Health Service. LEAD is taught not only to medical students, but also students in the Graduate School of Nursing. In addition, the LEAD team has worked with several faculty development programs and is trying to integrate the curriculum into other areas of graduate education. As director of the LEAD program here at USU, I will be discussing the reasons why this leadership curriculum exists at the Uniformed Services University. My colleague and director of LEAD Research and Development, Dr. Neil Grunberg, will be discussing the framework that we've used to build and focus our LEAD program. He'll be followed by Dr. John McManigal, the director of the LEAD curriculum, who will discuss how the LEAD sessions fit into the medical student studies over the course of their 4 years here at USU. So why do we have USU LEAD as part of the military health system? Why does it exist at the Uniformed Services University? What does it provide for the student? And why do we present leadership in this fashion? First, the Uniformed Services University incorporates into its mission statement that it's essential that we provide, quote, not only education and training to become professionals, but also that, quote, the university exists to develop leaders and officers for national defense and for the military health system. There was a charge set down by the highest-ranking civilian health leader in the Department of Defense, the Assistant Secretary of Defense for Health Affairs, that the Uniformed Services University, and here I quote again, must lead and excel in leadership training. He saw that it was essential that we outpace any institution in the world on leadership training, and so leadership was built as a mission domain into our USU Strategic Framework. This directive states that, quote, USU is unique among health sciences educational institutions by integrating leadership responsibilities and empowering students to develop necessary skills and abilities to become outstanding leaders at all levels of our nation's uniformed health services. And so, while leadership has been taught at USU since its inception in the 1970s, it became essential that the focus of leadership training shifted and was put into the spotlight as an educational cornerstone for USU students. As I've mentioned earlier, the LEAD team consists of Dr. Neil Grunberg, who is our Director of Research and Development, Dr. John McManigal, our Director of LEAD Curriculum, and finally, Hannah Kleber and Aaron Barry. The USU LEAD program was established to educate and develop values-based, team-focused, uniformed health leaders who are agile, adaptive, and innovative in the volatile, uncertain, complex, ambiguous, or VUCA environment of 21st century health promotion and healthcare delivery. It reflects the inclusion of the USU Strategic Framework leadership domain into the school's curricula. USU LEAD faculty and staff also conduct research and scholarship to identify, develop, and deliver effective leadership education and training relevant to the mission of USU and the needs of the military health system, our military families, and the health of the nation. Communication with the stakeholders of our nation is just as important as our mission here at the university. It is essential that our leadership framework resonates with leadership education at the country's military academies, as well as what is taught at all phases of professional development in the Army, Navy, Air Force, and U.S. Public Health Service. These include graduate medical, nursing, dental, and other programs, and officer schooling at all levels of military education. We look forward to our continued partnership with these entities and hope to increase LEAD's presence as the preeminent leadership program at our nation's leadership academy, the Uniformed Services University of the Health Sciences.